topic of today is about high blood pressure
and diabetes mellitus.
What is the cause?
It is nothing but the persistent rise in the blood pressure level. A lot of people don't even care about their blood level or sugar level. We eat a lot of things without care, without balancing our diet. The cause of BP is not known. We have essential hypertension and non-essential hypertension. Once you have been diagnosed with BP, you need to stop smoking, you need to stop alcohol, intake. Any drug you want to take, make sure you seek medical advice before taking it. Hypertension and diabetes mellitus are the type of disease we call manageable diseases. You understand? They are not diseases that when you have them, you can cure them. Anybody that tells you that he has cure for diabetes or he has cure for blood pressure, the person is not saying the truth. So yes, but we can manage it to the barest minimum. Yes.
What can you say about using of herbs?
Herbal medication are not advisable. They lack professional backup. They lack dosage. Any herb that you take, you understand? Any herb that you take has tendency to deposit in your liver. So, and it's depositing in your liver, there's no adequate metabolism that will grind the herb medication you've taken so that you excrete it in form of urine or feces. Hypertension is not a death sentence. But majorly we have type 1 diabetic mellitus, which is a juvenile onset, and we have type 2 diabetic mellitus, which is an adult onset. The juvenile onset is the one they give birth, your parents, it's genetic, you understand, you inherit it from your parents. The foot ulcer, you understand, diabetic foot ulcer, that's when it's setting the part of your leg, you understand, gets eroded, you understand, it gets eroded, it rupture, you understand, it starts bringing out some exudate, you understand. Yes, so now the medicals will now look at it and do some lab test. If it's reached some certain level, so there's no option than to go for amputation for it not to escalate to certain other parts of the body. I need your left hand.
I really sleep at night.
You have BP. So the major advice there is for the healthcare providers there to place you on antihypertensive drugs. Yeah.
Hi everyone, this is Waziri. If you are new around here, don't forget to click on the subscribe button and smash the notification bell. Follow us on all our social media platforms. And today we are talking about health talk with Pharmacist
Bature Waziri.
And what we are talking about is that I want you guys to settle down, relax, and listen. The topic of today is about high blood pressure
and blood sugar. Blood sugar, which is known as diabetes mellitus.
So let's just start with that high blood pressure. What is the cause? Most people are saying it's thinking.
Well, by way of introduction, I'm Pharmacist Bature Waziri here in New Busa. High blood pressure, which some people call it hypertension, it is nothing but the persistent rise in the blood level, the blood pressure level. Like the blood normally have a kind of pressure with which it flows, you understand, away and to the heart, you understand. I'm talking about oxygenated and deoxygenated blood. So if the blood is flowing above normal, above the value in which the World Health Organization considers it to be normal, then we now say somebody is having hypertension or high blood pressure, as we may call it. Now, what is happening is that a lot of people don't even care about their blood level. Many people don't even care about their blood level or sugar level. And what is happening is that a lot of things, we eat a lot of things without care, without balancing our diet. Fine, we quite understood that the situation of the country is giving somebody tough time in such a way that it's very difficult for you to see an ordinary person or an average Nigerian balancing the diet. But still, locally, we can still manage it. Well, one thing that is affecting our people is that some people are tested to be positive of hypertension or positive of the diabetic mellitus. But then they always find it a way of responding to it only when they feel certain symptoms. You understand? They forget that anytime you are tested positive of blood pressure or hypertension or blood sugar, that is diabetic mellitus, you need to be on your drug. You need to be on your drug for the rest of your life, except if you've gone to the hospital, the healthcare providers advise you on this or that. But many of our people feels that to take drug only when they feel headache or to take drug only when they feel dizzy. You understand? So that's one thing. But I'm thinking, as you just said, thinking is not something that causes BP. No, it doesn't cause BP. What it does is precipitate it. The cause of BP is not known. The exact cause of BP is not known. It's not known. What we hypothesize, or what was being hypothesized about BP, is that we have essential hypertension and non-essential hypertension. The essential hypertension are the hypertension with known cause. The non-essential hypertension are the hypertension with known cause. And the only hypertension with known cause is no more than 15% of 100%. So other 85% is not known. The only what we may trace to know the cause of hypertension for is maybe a disease called pheochromocytoma. You understand? Where when somebody have it, there is likely tendency for somebody to come down with BP. But others, no. It can be traced to familial history, like your genetic, yes, familial or genetic. When your grandparent, your parent, your mother, you understand, or you have risk factor for it. If you are obese, like you are fat, you understand, you can come down with BP. You understand? Or you have sedentary lifestyle, you don't do exercise, you eat anyhow, you don't control your diet. So all those things can be traced to because of BP.
Okay, like now somebody, let's just focus on the BP for now. If I have hypertension, like what are the food that I need to avoid and the food that I should be taking regularly?
Okay. Dieting is a very key factor in curbing hypertension. You understand? The more you eat meat with fat, with a lot of fat or red meat, the more it becomes like deposit in your blood vessels. And as it's depositing in your blood vessels, that's how it's narrowing the spaces through which your blood flows. So as it's narrowing, the pressure will be increasing. And as such, your blood pressure will keep
I learned that alcohol too is a major factor, that if you are taking alcohol, you need to reduce alcohol. Yes.
You see, alcohol, cigarette smoking, drugs like NSAID, like when I say NSAID, I mean diclofenac, ibuprofen, and other things, and other sort of drugs. You understand? They increase your BP. So that is why once you have once you have been diagnosed of BP, you need to stop smoking. You need to stop alcohol. Intake. You understand? Drugs, any drug you want to take, make sure you seek medical advice before taking it.
So you mean hypertension has no cure, but you can reduce it to the lowest minimum?
Yes. Hypertension and diabetes mellitus are the type of disease we call manageable diseases. You understand? They are not diseases that when you have them, you can cure them. Anybody that tells you that he has cure for diabetes or he has cure for blood pressure, the person is not saying the truth. So yes, but we can manage it to the barest minimum. Yes.
And like what can I say about using of herbs? Because most people say stop using orthodox medicine, stop using orthodox, use herbs. And most of those herbs, sometimes herbs are good, but most of those herbs they are not well prescribed. And most of these people selling herbalists, they are not that professional. So in what way can you, in terms of herbs, is it advisable or is not advisable?
You see, in the herbal medications has there are a lot of controversies with herbal medications. But what we can say for now is that herbal medication are not advisable for certain diseases because they lack professional backup. Number two, they lack dosage and dosage forms. You understand? So any drug that we take that you can't actually determine the dosage. You understand? It's harmful to the health. You understand? So that is why. And number two, any herb that you take, you understand? Any herb that you take has tendency to deposit in your liver. So, and it's depositing in your liver, there's no adequate metabolism that will grind the herb medication you've taken so that you excrete it in form of urine or feces. You understand? So it's post problem to the liver as well.
Is hypertension a death sentence? Because most people, once they've been diagnosed with hypertension, the thinking will now increase.
Hypertension is not a death sentence. It's never a death sentence. A lot of people you see around have hypertension, especially the aged, male, being it male or female. You understand? The aged. Mostly you see people with hypertension, but if you are regular on your medications and you normally seek for medical advice, you understand, you live your life normal as every other person.
Okay.
Yeah.
Let's just brush into diabetes.
Okay.
Because to me, diabetes is something dangerous because it kills slowly. Regarding that diabetes, what is just scaring me is that sometimes it leads to amputation of leg.
Yeah.
What is the real cause? Cause is it sugar?
You see, diabetic, as we all call it in the town, medically we call it diabetic mellitus. So there are
Hausa they call it chiwon sugar.
Chiwon sugar, yeah. There are a lot of we have 2, 3, 4 to 5 types of diabetic mellitus. But majorly we have type 1 diabetic mellitus, which is a juvenile onset. And we have type 2 diabetic mellitus, which is an adult onset diabetic mellitus. The juvenile onset is the one they give birth. Your parents, it's genetic. You understand? You inherit it from your parents. Right. You understand? And that one you can only manage it with insulin, diet, and exercise. You see, diabetic mellitus is also genetic, just as hypertension. Yes, you understand. But if you have if you have sedentary lifestyle or you have excessive alcohol intake, you understand, you could come down with type 2 diabetic mellitus.
Which is dangerous.
It is very, very dangerous, you understand. Though that is why you see, and the treatment approach differs, you understand. The way you approach type 1 is different from type 2, you understand. Because in type 2, there is absolute destruction of the beta cells in the islet of Langerhans. You understand? So the insulin is not either not produced enough, or it is produced, but the system is faulty. You understand? So you need an exogenous insulin. You understand?
Why mostly they do amputate legs and hands? What is the cause? Is it for it not to escalate to the other part of the body?
Yes.
Because I'm always scared of that.
The amputation. That is,
and it seems that is what is part of what is affecting this Mr. Ibu Nollywood.
Okay.
His leg now they've amputated.
They have amputated it. Okay.
Diabetic similar.
Yeah. You see, we call that diabetic complication. It's a complication of diabetes. Now we have macro and micro complication of diabetic mellitus. So diabetic foot ulcer is a complication of diabetic mellitus. It can come as a result of lack of proper care. You understand?
Negligence.
Yes, negligence. You understand? Because they will ask you not to eat this, not to eat that, do exercise, be careful on what you do. Be conscious of yes. So if you are not careful, you come down with the diabetic complication, which is what? Amputation. Before the amputation, you must have the foot ulcer. You understand? Diabetic foot ulcer. That's when it's setting the part of your leg. You understand? gets eroded. You understand? It gets eroded. It rupture. You understand? It starts bringing out some exudate. You understand? Yes. So now the medicals will now look at it and do some lab test. If it's reached some certain level, so there's no option than to go for amputation for it not to escalate to certain other parts of the body. Yes.
What is your advice to people, diabetic patients?
Okay.
Because what is your advice, like those watching us that are diabetic patients?
The diabetic, my advice for them is whether you know or you are unaware of your health status with regards to hypertension or diabetes. If you don't know your health status, it's better you should check and know. And whenever you are being diagnosed of BP, of hypertension or diabetic mellitus, please accept it. Accept it with faith. It's not a death sentence. A lot of people live with it, survive it. You understand? Survive. No, it's not a problem. You understand? But many people will be diagnosed of it and they will refuse to even accept. A lot of cases that comes down with straight to diabetic foot ulcer without even managing it. You understand? Because they might have probably been diagnosed of it, but they pay less attention to it. So whenever you have been diagnosed of it, please follow your medical advice. Follow whatever instruction given to you. You will live your life well. And if you are not if your health status is not known with regards to diabetic or hypertension, please do that. It's better you know.
So what you're saying is that it doesn't matter. You have to go and check your health status regularly.
Yes. It's good you should check, especially if you know your parents.
And it's killing a lot.
It's killing. Sudden. Look, I don't want
somebody like a close friend, just like an uncle to me. Okay. But his own is high blood pressure. 3 weeks ago.
I lost my mom. I lost my mom. I lost my mom
so
to hypertension, but not now. It's far long before I even become a medical person.
And
before
I become a pharmacist.
Yes, no. Because it's rise of BP. When the BP shoot to certain level, you understand, the heart has a kind of pressure it can accommodate. When the pressure exceeds what it can accommodate, you have nothing. Yes. So that is just it. So I don't it's not good for us to start mentioning them, but we all know most 95 to 99% of the sudden death we have is as a result of either high blood pressure or diabetic mellitus.
That is my uncle 3 weeks ago. He's on his high blood pressure.
You see. So that is just it. So please, I would like people to take conscious of all their health concerns, especially diabetic mellitus and hypertension.
How can they get in touch with you? Do you have a social media like Instagram?
Yes.
Because a lot of people are facing this and they want counseling and everything.
Yes. I have social media handle, but I'm more on Facebook. So you can check me at Bature Waziri or Ismail Bature Waziri. You understand? Anytime you have a problem, I'm always ready. to come to your aid.
So you understand? To save life.
Yes, and if you are in Febi, if you belong to Febi platform, you can check my number there. I'm always available. I'm always ready to help. Lest I forget, my boss, who is Lambus, Honorable Lambus, the vice chairman of Borgu local government, last 3 to 4 months, spoke to us, 3 of us, about sensitizing people regarding this diabetic mellitus and high blood pressure. But I'm sure things are just much on him. But inshallah, we will get back to us and everything will be done amicably.
On this platform, we are going to be talking a lot about health matters. The name of this program is Health Matters, and we are going to be dropping a lot of episodes. So I just want you guys to subscribe to this channel, follow us on Facebook, on YouTube, and this is just the first episode. We are going to bring him back to this channel. Comment down below. He's going to be reading some of your comments, and if you want us to discuss about another topic, this is just a highlight. This is not even the main, like diabetes and hypertension. This interview is just a short one, so we are going to dive deep. Maybe the next interview we are going to talk about is going to be like an hour.
So
this is just and highlights a sneak peek of it. And if you want us to discuss on anything like HIV, malaria, so
yeah, I'm ever ready. I'm ever ready for you.
Just put it, the comment section is there.
I need your left hand.
Like this one. Why do you sleep at night?
Woo! So let's just see.
Okay. These services you are rendering for me, in hospital, I'll pay money.
No problem, no problem.
You're enjoying free service.
So,
as bit as well.
So we are done checking. Normally, medically, it is advisable to take it 3 times. You understand? And take the average. What I mean by average is adding the 3 divided by 3. So you have the average. So normally, before you diagnose somebody of BP, it has to come at least 3 times on different occasions. Yes. And in each one, you are taking average.
Is it in a week or a day?
No, not a day. Like week. Like maybe when
it come on Monday.
Yes.
On
Wednesday. Yes. When it's given constant what do you call it, value, or the values differs just 5 or 6 or something, you understand? So you now diagnose somebody of BP. You can't just test somebody today and think it's the person have BP. No,
so it won't give you accurate results.
No. You can't diagnose somebody.
Now, the advice that you can advise me for my own good, I should go to hospital tomorrow.
No, not tomorrow. Okay. Not tomorrow. At least give it maybe 3-4 days. Yes.
So
yes. Maybe after then, maybe you give a week again. Then before you go back, if it's given constant results or plus or minus 5, you understand? Then you know you have BP. So the major advice there is for the healthcare providers there to place you on antihypertensive drugs. Yeah.